So it's not really something that much people would actually talk about. So I think it's a good topic to actually talk about and get out there, because some topics like these in terms of education, they're actually lacked in the school, because like sexual health, for example, I can use a typical example, the school where I teach in, there are some kids, teenage kids, who in terms of a hygienic way, they can't even care for them own selves. You just have to
Mm.
call them in a corner and point it out to them. And girls, big girls, boys. So I think it's something that it's a good topic.
Sounds good. Whose dog is that? Hi, Shanta.
Oh. Hi, Ingrid.
There's a
Hi, good
barking
evening,
dog.
girls.
Hi, Shanta. How are you?
Not bad. Sorry for the
No
lateness.
No worries.
All right, you girls can go ahead as well as Leek.
Okay, sounds good. We're good.
Should
to
we
get
start?
started. Yeah.
Yeah.
It's
Okay.
5 after, 6 minutes after 7.
We will start then. Welcome back. We are QHO. Welcome back to another workshop. So today we are going to be talking about sexual health and healthy relationships. So let's get into it.
To begin, let's just introduce QHO, also known as Queen's Health Outreach. We're a student-run organization that works alongside communities locally and abroad, such as you guys in Guyana, to facilitate peer-to-peer discussions on topics related to health. As members of QHO, we are here to educate and build conversation. As a forwarding and a reminder, we are a student-run organization and we are not professionally trained in any way, shape, or form, as we are not healthcare professionals.
Okay, so just a quick intro on us. My name is Liv and I go to Queen's University in Canada. I am interested in medicine, science, travel, outdoors, spending time with friends and family as well. And a fun fact about me is that I play guitar.
And I also go to Queen's University and I study health sciences. I also love traveling, baking, going on walks, and reading. And a fun fact about me is that I have the same birthday as Terry Crews.
Okay, so for the agenda today, we are going to be talking about menstruation, sexual intercourse, and contraceptives with some activities sprinkled into there, then STIs, HIV and AIDS, and more activities and a wrap up.
So to begin, we're going to start with the topic of menstruation. So what is menstruation? They're also known as periods. That's the most common title for them. And what happens is that our body produces a thick lining of tissue and blood that contains nutrients that would nourish a baby if pregnancy would occur within our uterus. And menstruation is when this lining is passed out through the vagina because pregnancy does not occur. And menstruation can last between 2 to 8 days and occurs every month. The typical cycle is around 28 days. But it can be irregular, and that is totally normal. And there could be a lot of reasons why you would have a regular cycle. You know, it could be changes in diet, exercise, stress. So a lot of other reasons. Oh, can you go back? Okay. And menstrual fluid is reddish brown and mucus-like, and women typically stop menstruating if they conceive or if they're breastfeeding, and menstruation starts from puberty. So the average age is 13, but it can start anywhere as young as 8 to 18 years old and stops at around menopause. So about when you're 50 years old or older. Next slide. So menstruation can come with some symptoms such as headaches, mood changes, nausea, cramping, tender breasts, hormonal changes, which could lead to acne or cold sores, joint or muscle pain, bloating, diarrhea, or constipation. And whether or not these symptoms happen at all or the severity of these symptoms depends on each person. You know, some people might not have any symptoms at all, and some people might have really bad ones. And these symptoms can occur during your menstruation cycle or right before. So we would refer to that as PMS. And women use a variety of different methods to absorb their menses, which is like the blood and lining that is excreted during our periods. So some examples include sanitary pads, which are like long, cushiony pads that are attached to our underwear, which absorbs anything that flows out of the vagina. There's a tampon, which is a cotton cylinder that is inserted into the vagina to absorb the menses. There's menstrual cups, which are similar to the tampon in the sense that they're inserted, but they're made out of silicone, which means they're reusable if you wash them. And then another alternative are the pad underwear, which is like an underwear with a pad installed. There are reusable ones made out of fabric that can be washed, or there's disposable options where they're similar to a diaper, which we call overnight period underwears. So now there is an activity. Basically, we're going to show you a picture of a menstrual product of the ones that I just mentioned, and you would match them to whichever product, and there's going to be a word bank on under the photo.
All right, what do we call this period product? Feel free to turn on your mic, type it in the chat, whatever you feel.
Yeah, or if you guys want to like circle it with a draw tool, do whatever you guys want. Sanitary pads, that is correct. Want to just go to the next slide real quick?
Yeah.
Yeah, the answer is sanitary pads. How about this one? Period panties. Yes, this one is a reusable one since it's made out of fabric. So if you were to use it, you would just wash it afterwards. Next.
Nice.
Yes, the answer is tampons. And last but not least,
menstrual cups.
yeah, they look, they come in different shapes and forms. So yeah, okay, moving on to our next topic, which is
Excuse me, girls.
Yes.
There are one that it's made of cotton material. And do you know how the rags are? Like a normal baby rag?
Yeah.
Okay. I usually get like those that I distribute and give very poor people who need to use them. It's you could insert it in a pocket and then it's used with a clip to the underwear.
All right.
Oh.
It's very nice and very much. 1 minute, please. Wait a minute.
No worries.
And it's washable to use.
Good to know.
Wow. Yeah.
Also, it was said that it helps women from preventing us from getting cervical cancer.
Oh,
Yeah.
I didn't know about that. Thank you.
Yeah, I do have one. After it's finished, I'm gonna probably take a picture and show you guys what it looks like.
Yeah, that sounds like a really great option.
Thank you.
Or maybe in a while I'll get one and show you guys in a few seconds from now. And then you could share it on screen.
That would be really great.
All right, dear. That's my input on that.
Yeah, thank you for your insight.
Shanto, what is that called again?
It's sanitary reusable pads.
Oh, okay.
It's washable.
Oh, okay.
Yeah, I'm gonna get a picture and show you guys what it looks like.
Cool.
Okay, great. Okay.
I don't think much people knows about it, but it's very, very hygienically safe for women to use,
That's good.
especially those women who are suffering with their menopause.
Mm-hmm.
It's very, very healthy for them to use it.
Yeah.
Cool.
So I'm gonna get the picture and let you guys see what it looks like.
Okay.
So if you want to pause for a minute or two, let me show you what it looked like, and you can explain.
Okay.
Okay.
Give me a second, please.
Okay.
Oh,
Oh,
very interesting. I see.
yeah. They look soft.
Yeah, that looks good. And you just wash it normally, like with your like how you wash your other stuff? Oh, yeah, I've seen that. I've seen
Oh.
that.
Yeah.
Shanta, I don't know if you
All right.
are-
Sorry about that.
okay, no worries.
This is the padding that you set it in,
Mm-hmm.
right? That's it there. So when you're setting, you could even use your sanitary pads into these paddings for safety wise, because sometimes we use our pads and it shifts away while walking our stuff.
Yeah.
So with this now, when it's insert into the pockets like this,
Uh-huh.
it's insert into the pocket, and when you clip it on the underwear, it becomes like this, so it doesn't move at all.
Oh,
That's
okay.
good. That's
So
good.
Yes.
you just have to wash like the flower part, not even the whole
Wash.
thing.
Yes. You could wash the whole thing. If you have more than one, you could wash it. Because this is also very, it doesn't causes any bruises either between the legs or any gall between the legs.
Interesting.
So
Okay.
this is very, very much healthy and safe for especially women who are suffering with their menopause.
Yeah.
Yeah. So that's what I was explaining.
Thank
to
you
you
for
guys.
showing us.
Yeah.
Yeah, you're welcome.
If you guys ever want a different menstrual product alternative, there's one for you.
That's pretty cool.
Yeah.
Okay, we can move on to the topic of sex.
Yeah. Okay. So, what is sex, which is also known as sexual intercourse? Commonly denotes the insertion of male penis into a female's vagina for sexual pleasure, reproduction, or both. So we would refer to that as vaginal sex, but sex can also describe other activities such as oral sex or anal sex. And during vaginal sex, the process is essentially a man becomes sexually aroused and gets an erection, which makes his penis stiffer, which would allow him to insert it into a woman's vagina. And typically during sex, both parties involved would have an orgasm. So next slide on what is an orgasm. So it is the climax of sexual excitement that is associated with intense feelings of pleasure And in general, the body will have an increase in heart rate, blood pressure, and breathing rate. And among women, they will experience rhythmic muscle spasms in the vagina or pelvic floor. And among men, the penis will ejaculate semen that contains sperm. And if protection is not used, semen can enter the vagina and potentially impregnate the woman. So that relates to the next slide, which addresses the risks of sex. So although sex can be fun and pleasurable, there are risks associated with unprotected sex, such as unplanned pregnancy or the transmission of STDs or STIs. And this doesn't mean that you can't have sex or it's a dangerous thing, but it just means that you should plan accordingly and use contraceptives if needed. Furthermore, you should always remember that having sex is your own choice and consent is super important. You always want to make sure that you and your partner both are prepared and want to have sex. And you should always know that even if you give consent beforehand, you're always allowed to change your mind and say like, hey, maybe I'm not ready for this. Maybe I don't want to do this anymore. That's totally okay. And you should never have sex if you're not comfortable with it. Moving on to our activity. So we'll be putting up some statements and you're just gonna say if this is true or false, and I'll just give further explanation for the answer. Number 1, you can have sex without orgasming. Okay, Cindy. True.
Nice.
Yes, that is true. Many women and men can have intercourse without having an orgasm, and that's totally normal. And some causes for this could be like nervousness, unexpected circumstances, or just personal reasons, and you should never feel bad about that. Next statement, you can only get pregnant if someone ejaculates in you. True or false? Getting some mixed responses. The answer is actually false. As long as semen comes in contact with the vagina, you are at risk of becoming pregnant. So some scenarios where this could happen is like if the penis is inserted in the vagina unprotected and pre-cum comes in contact with the vagina, this pre-cum can contain a little bit of sperm. And although it's a small risk, it still is a risk that it can impregnate you. Other scenarios could be like ejaculating on a body part near your vagina and like it accidentally enters, or onto an article of clothing that later comes in contact with your vagina after sex. So those are all like some risks you might want to consider after sex. So yeah, great job, guys. The next topic is contraceptives. So what are contraceptives? They're also known as birth or fertility controls, and these are methods or devices used to prevent pregnancy. Some of them can also protect you from STIs, so it's important to choose wisely and choose what you think is needed. As well, some of these can stop your menstrual cycle or help with the symptoms along with your menstrual cycle. So if you want your period to temporarily stop or relieve these symptoms, you might want to consider these options. So these options include the hormonal female contraceptives. So these don't protect STIs, but they can hormonally prevent pregnancy. So the first one is the birth control pill, where essentially you take one pill a day at the same time every day, and these can help reduce period symptoms or stop it completely depending on the type. So do your own research, and it also has many symptoms such as gaining or losing weight, gaining or losing acne, changes in mood, etc. There's the injectable contraceptive, which is a kind of like a shot that you insert every 3 months. So that involves less commitment, but it does require a healthcare professional. There's the IUD, which is a plastic or copper device that is inserted into your uterus for 5 to 10 years, and it can potentially stop your period. And last but not least, there's the morning after pill, or Plan B, which prevents pregnancy after the act of unprotected sex. So you would want to take this within 72 hours of intercourse, and it is only 89% effective, while the other ones I just talked about are at least 97. And you only want to use this as a last resort, since continuous use of Plan B can be extremely debilitating onto the body. So the other type of contraceptives are the barriers, and these do protect against the STI. So there's the male condom, which is a barrier that is put on to wrap around the penis before making contact with the mouth, anus, or vagina. So these are the most accessible form of birth control and are 98% effective. Just some like tips, you never want to use more than one condom at the same time, since they can rub against each other and cause them to break. So that could mean there's a risk of like semen leaking. So you just want to stick to one and ensure that the condoms are placed in a cool or dark place so that it doesn't potentially like rip while rubbing onto other things, such as like in a wallet, and you don't want them to expire either. So those are some things to consider. And on the other hand, there's the female condom, which is less accessible and less common. So essentially they're rings with plastic attached that would be placed inside a woman's vagina. And they're only 79% effective, since it is more difficult to use than a male condom. So, if you struggle to choose between the two, the male condom is more reliable in that sense. Now there's another activity. So similar to the menstrual products, we're going to show you a photo and then you would match it to a contraceptive. Next.
Any guesses?
Okay, someone underlined the morning after pill.
That is correct.
That is correct. Usually on the box, it will say Plan B. I just wanted to make it a little bit harder for you guys. But if you ever want to look out for it, it will typically say Plan B, and some stores will keep it behind the counter. So like, don't feel afraid to ask the counter if you can't find it in stores. Next.
Yeah,
the IUD. This is a copper one, and the photo is an example of a real life one. So that's actually what would be inserted into you if you were to get one yourself. Next.
nice. Male condom.
Nice. This is the male condom, which can come in like many colors or patterns. So this one is pink, but typically they are like clear or a little bit yellowish. And as you can see, like in the photo where the ring is, that would be placed over the tip of the penis for the condom to like be rolled down the shaft. That's how you would use a male condom.
Okay, so now I'm going to be talking about STIs. So an STI is a sexually transmitted infection. So sexual describes how these types of infections are transmitted. So this can be via oral sex, anal sex, or vaginal sex. It is transmitted from outside the body and then into the body, and specific types of contact must occur. And it's an infection because it's a disease-causing organism and something that can cause harm to our body. Okay, so how are STIs transmitted? So each STI has a specific mode of transmission. The following are some examples, but be aware that these are just the most common modes of transmission. Additionally, each STI can have several modes of transmission, and they're not all discussed below. So bodily fluids, this can be blood, semen, vaginal fluid. Skin, so this can be rashes, sores, warts, and mites. Or it can be on the pubic hair, such as pubic lice. So it can also very rarely be spread by the use of personal items. So any item that has come into contact with modes of transmission, this is lower risk. All right, so some symptoms of an STI could be swelling of the genitals, an odor, itching, tenderness, abnormal discharge, so something that you don't usually experience in your discharge, redness or rash, inflammation, pain, and sores generally around the genital area. So now I'm going to talk about the types of STIs. Number one is a bacterial STI. So it spreads through sexual contact. An example of this is gonorrhea or chlamydia, and can be treated with antibiotics in medicine. However, if it's left untreated, a bacterial STI can cause permanent damage to the body. Infestations is a bug that burrows into the skin like scabies, or can crawl around the pubic hair like pubic lice. They can lay eggs and be itchy. So an example is crabs or scabies, and they are treated by using special shampoos and washing sheets and clothes. A viral STI is a virus that gets into the body and causes disease. Viral infection cannot be cured. Example is HIV at the moment. However, if they are untreated, they can cause serious harm and damage. Now we're going to do a quick true or false activity. So you can just type T or F in the chat. We can get STIs through oral sex. We can't, sorry, it says we can't get STIs through oral sex. Do we think that's true or false? Yeah, that's false. Correct. Oral, vaginal, and anal intercourse are all modes of transmission of STIs. Next question, a person can always tell if they have an STI. Correct, that is false. So many symptoms are very hard to recognize if they even show at all. That's why it's important to get tested regularly if you're sexually active. Abstinence is the only way we can stay 100% safe from STIs. Yeah, so abstinence is the only 100% effective mode, but obviously that's an unrealistic expectation. So it's important to remind you and your partner to stick to safe sex ways like contraceptives. Testing for treatment and STIs are kept confidential with your healthcare professional. Right, that is true. STIs are only in some parts of the world. Right, that's false. STIs affect people all over the world. STIs can cause major health problems and can result in death in most serious cases. Correct, that is true. And the last one, only people who have vaginal, anal, or oral sex can get STIs. Correct, that is false. STIs can be transmitted from mother to baby through pregnancy, childbirth, or breastfeeding. It can also be transmitted through shared personal items like razors and needles. Okay, awesome. So now we are going to talk about discussing safer sex. Practicing safe sex can significantly reduce the risk of transmission of STIs. However, starting a conversation with a partner or potential partner about safe sex can be tough. The reason that it's tough is it's difficult to be assertive when negotiating safer sex, as you may be worried about your partner's reaction. Some may worry about not knowing how to use protection. As well, many cultures do not speak openly about sex, and this can make it difficult because no one is talking about it. However, none of these factors should be any reason for you to take a chance with unsafe sex. When someone brings the subject up, it's highly likely that they will find the person has wanted to bring up the subject too and just feels unsure or awkward about it. Not only does talking about safe sex show that you respect yourself as an individual, but it also shows that you respect your partner as well. However, if the partner does not like the idea of using protection, like a condom, you can always ask and be persuasive about the benefits. Practice other methods of safe sex that don't involve exchange of bodily fluids. Walk away from the partner. Just remember that you deserve protection from unwanted pregnancy or infection. Sometimes, despite our best intentions, safer sex does not happen every time. And some people may be less careful if they have been drinking, and others may forget in the heat of the moment. But don't give up with safer sex because of a slip up. It's a very important practice. Okay, so now I'm going to be talking about HIV and AIDS. So what does HIV stand for? It stands for Human Immunodeficiency Virus. It only affects humans and it can be transmitted through certain modes of transmission between humans. Transmission cannot happen through mosquitoes, monkeys, or any other animals, which is a common misconception. Immunodeficiency means that someone with HIV has a weaker immune system, which means they are more prone to getting sick from colds and other illnesses. And virus just means that it's a small particle that infects cells. Okay. Now I'm going to talk about transmission. So how is HIV transmitted? It's transmitted from infected individual to another. So a person who is already infected with HIV has intercourse with another HIV positive person. Mode of transmission, HIV can only be transmitted via bodily fluids from an infected individual. There needs to be a way for the virus to leave the infection the virus to leave the infected person's body. And there are 4 major bodily fluids that HIV can be transmitted. So this can be number 1, which is blood, fluid, blood contact, open wounds, sharing of needles, pus, and menstrual fluid, semen, vaginal fluid, and breast milk. Okay, that's how you get transmitted. So how to get tested for HIV. So one should consider getting tested for HIV if they or their partners have ever had sex, especially anal or vaginal intercourse without using latex, condom, or other protective barriers. Having sex while under the influence of alcohol or drugs that you did not use protection for, tested positive for another sexual transmitted or bloodborne infection like syphilis, gonorrhea, or chlamydia. Shared needles, syringes, or other drug use equipment, had a tattooing or piercing or acupuncture with unsterilized equipment. If the result is negative, one may experience less stress and anxiety in their life and can learn more about how to reduce the risk of becoming infected. However, if the result is positive, one can get early treatment to stay healthy and take precautions to avoid transmitting HIV to others. If the individual is pregnant, early treatment will also reduce the chances of the baby getting HIV. So treatment. Unfortunately, there is no absolute cure or vaccine for HIV and AIDS. A person with HIV can eventually progress to AIDS. However, ARV drugs exist to treat the symptoms and prolong life expectancy. So ARVs are a drug to treat the HIV virus and slows down the virus. And it actually has grown to just be 1 pill a day, and it pretty much reduces all symptoms and transmission of HIV. So that is like the newest drug that they are working on right now, and it is free and paid for by the government. Okay, so our final activity is typing in the chat or saying out loud, what have you learned this session and what do you want to learn more about? So I can start. I learned about the other feminine sanitary products from Shanta. Thank you so much for explaining that to us. It's nice to learn and teach at the same time.
I can go next. I actually learned what HIV stands for once, because like every time I've learned about it, like they just refer to HIV. So it's nice to know that like it's actually an acronym for human immunodeficiency virus.
So Ryan says, I learned many new things as being male. It's nice to know more about female perspective of things. Yeah, I totally agree. Learn more about the science in general of STIs. I learned a lot of things about staying safe. Yeah, that's our goal. Just talking about important stuff in regards to safe sex. Yeah, really awesome. Yeah. So that is everything. Now we have some time for questions or discussion. If anyone wants to say anything before we wrap up.
Yeah. And like while people might be thinking about questions, do you want to show them the resources?
Yeah. Here are some resources in Barvies for STI testing, if anyone needs it.
Thank you, Ryan.
So just one thing I would like to add, on the purpose of, like you said, HIV, we know, human immunodeficiency virus, it leads to AIDS, right? Which is the acquired immunodeficiency syndrome. So I'm not sure if you guys touched on how it operates, but I can shed a little light behind the science of the virus.
Please do.
Because in terms of this virus here, our body has some cells that are known of lymphocytes. And lymphocytes are our memory cells. So it's one of the two types of white blood cells that are present inside of the human body. So the very first thing that you would find is that HIV, it will start to infect cells and the infection will continue more to our memory cells. These cells are known as memory cells because these are what register the antibodies that our body can produce in order to maintain and boost our immune system. As such, as these cells are being infected, they're being destroyed on a continuous basis. So this here is known as a latent phase of infection. As such, the person is said to be HIV positive. Now, over time, eventually your body will start to lose the cell. The cells will deteriorate, damage, and eventually be destroyed, and they would die. And our body cannot, in terms of produce more lymphocytes at the rate at which they're being destroyed. And as such, our immune system would actually fail us. That's why its name is deficiency. Because at this point of time, in this perspective, this is when it's actually known as AIDS, or the condition would actually step in. So due to failure of this, it will result in our body being exposed to many different diseases. And among AIDS sufferer, one of the most common disease that is there is known as tuberculosis. And eventually, when our body can't fight many diseases at the same time, including the AIDS, that is when it results in death. So that's it for me. Thank you.
Thank you so
Amazing.
much.
Thank you.
Yeah,
Love learning
really
more.
great information.
All right, that is all for our presentation today. Thank you so much for joining us. And yeah, I had a great time. Thank you so much, everyone.
Yeah.
Great job, girls. That was awesome.